Hello, everyone. We want to welcome you to ALS Canada's 2024 webinar series. The focus today is going to be all about communication in ALS. We are joined by two amazing presenters, Avner Ziefman, Speech Language Pathologist for Sunnybrook ALS Clinic, and Melody Chow, Communication Disorders Assistant at the Assistive Technology Clinic in Toronto. The focus of today's session will be discussing how ALS affects communication and the supports that are in place to assist throughout the disease. So please feel free to put all of your questions in the chat box, and we will be answering all of those questions at the end. So to get things started, I would like to introduce Avner and Melody.
Thanks so much, Emily. And I should be able to share my screen. Here we go. So let me just get my presentation up, and then we can get started. Can everyone see the page?
Yes, we can.
Okay, awesome. So, sorry. So our presentation, as Emily said, is about communication and ALS. The webinar today is intended for patients and families of persons with ALS, but it's also open to the public and anyone interested. I know I sent a lot of emails, so happy for anyone who was able to join today. And the content will cover a brief overview of communication and the relevant supports for all stages of the disease. I just want to mention a couple points before we get started. One is that the topic material can be a bit heavy, especially if it's something new to you. So if you do feel a bit overwhelmed or uncomfortable, we understand if you need to step out. I actually can't see anyone on the call, so don't worry, I can't see your video screen, although I'm looking forward to your questions at the end. It's because it's also a brief overview. It's kind of focusing on everything about communication in ALS. So some attendees might find the material to be a bit repetitive if it's something you've heard before. Some folks might find it a bit advanced or, like I said, overwhelming. So, but just in terms of the pace, if we're going a bit too slow for you or a bit too fast, I do apologize. But there should be something for everybody here. And if you do have questions, like I said, please write them down and we'll get to them at the end. So again, the title is Communication ALS. When should I be referred to an AAC clinic, and what in the world is AAC? I promise we will answer these questions by the end. So I'll introduce ourselves, although Emily gave us a great introduction. I'm Avner. I'm the speech language pathologist at the ALS clinic at Sunnybrook. I also split my time between Sunnybrook and the Assistive Technology Clinic, which is an AAC clinic. And I'm joined as well by my colleague Melody, who's a communicative disorders assistant and the equipment manager at the Assistive Technology Clinic AAC clinic. So we did put together some learning objectives today. We're going to learn about how communication is affected in ALS. We're going to attempt to define augmentative and alternative communication, which is AAC. We're going to learn about various tools and strategies to support communication, and as well as the role of what AAC clinics do and their funding structure in Ontario. We're going to identify when you should be referred to an AAC clinic, so stay tuned for that. And at the very end, we're going to give or Melody is going to give a brief demonstration of some high-tech communication devices. So if you do find it a little bit slow, stay tuned till the very end, because that's going to be the fun part. So communication and ALS. To understand about how communication is affected, we have to understand what ALS is, and most everyone on the call is probably aware. ALS is a progressive neuromuscular disease that causes a loss of motor neurons, which are the nerve cells that control voluntary movement. There are many variations of the condition, and the rate of progression can vary significantly from person to person. But there are two general classes of symptoms, and the initial symptoms are typically either bulbar or spinal. So when we're looking at bulbar symptoms, those are symptoms that affect speech and swallowing, whereas spinal symptoms affect the upper and lower extremities, your arms and legs. In typical ALS, patients will experience both bulbar and spinal symptoms at some point along the disease trajectory. But symptoms are always mild at first, and it's also difficult to predict the rate of how long you will experience these symptoms when you expect to experience bulbar versus spinal symptoms, or how much they'll progress. But that's why we always advocate for having communication supports available to you, and as well as accessible to you as soon as you need them, and ideally before you absolutely need them. So when we talk about how bulbar symptoms and speech specifically, we typically refer to dysarthria. And dysarthria is the term we use for the motor speech disorder that's associated with ALS. In general, dysarthria is characterized by weakness and imprecise speech. And there's different collaborative efforts of different systems that produce speech. And so dysarthria is a combination of these different systems. Because symptoms are so variable, we do see different presentations of dysarthria depending on which system or combination of systems are affected. So just to break it down, we have articulation, which is the pronunciation of words. If articulation is affected, we might experience some slurring of our speech. Your voice refers to your vocal cords, which control the sound quality of your voice. You might have a bit of a strained voice, or a raspy voice, or a hoarse vocal quality, and as well as the volume. Breathing is the power source of your voice. So your vocal cords are what create your voice, but that only the vibration only occurs because of the power of your breath. And so if breathing is affected, that can contribute to your speech impairment, and it can also affect your volume. Some folks also use breathing devices, and just having a mask can affect how people are able to hear you, even if your speech is quite clear without the mask. Resonance is an interesting one that really refers to where sound travels. So if you think about the difference between a flute and a tuba, that you can play the same key in both instruments, but they sound quite different, and it's because of the space in which it's traveling. So when we're with our speech, everyone has different tubes, in terms of their bodies and the shape and structure. And there's also a difference where the sound travels, whether it's going up through your nose or your nasal cavity or through your mouth. And so some folks might have a bit more of a nasal quality to their speech if resonance is affected. And then prosody is the rate and flow of speech. So, speech can be a little bit slower than you'd like it to be, and the flow can be a bit stunted as opposed to kind of fluent speech. There can be involuntary breaks in your speech. So just as a reminder, symptoms are always mild at first. So you might notice a slight reduction to your speech rate. Your speech is a bit slower, and other people might not even notice this change. The other thing to remember is that there are tools and strategies to help you at every stage. So even though we do expect the changes to come or get worse over time, there's lots of tools available, and there are specific tools depending on what your needs are, so which we'll get to. So communication is not just speech, it's really an interaction between two or more people. And so there are different forms of communication. Verbal communication would be speech, and that's going to be related to the bulbar symptoms. But there's also written communication, which is physical and electronic writing, right? Typing using a pen or a pencil, and that can be affected by spinal symptoms. So really, everyone with ALS might have some impact on their communication ability, regardless of which specific symptoms they're experiencing. So what is AAC? I promised we were going to answer that question. The term for AAC, or AAC, is a short form really for augmentative and alternative communication. And what that really refers to are tools and technologies to support communication, computer access, and writing. AAC is meant to support and not replace speech. So it's not that you know, we're going to start using some form of AAC, and we'll explain more what the actual forms are. But it's not that you're going to start using some AAC and we're going to stop talking. It's a tool to help you. It's also important to remember at this stage of technology, AAC is always going to be slower than natural speech. But we will discuss some really neat methods to increase your efficiency using AAC. And you can also get a lot more proficient with practice. And that's part of why we recommend it, getting used to it earlier rather than later. And something also to consider is that AAC can actually help improve your actual speech. As we know with ALS, one of the big characteristics is fatigue. And your speech can get worse from being tired. And also when, if you're tired, it's harder to talk. So if you have a different tool to help you communicate outside of your speech, that will help preserve your energy and actually make your speech more clear for the times that you would like to actually use your speech. AAC can mean different things for different people and at different stages. Like I said, we're going to talk about those more specifically in upcoming slides. But we like to think of it as an umbrella because there's so many different strategies and tools that fit under the umbrella of AAC. And it's really about considering what your needs are, and as well as many other factors. So we consider your function level, whether you have bulbar symptoms or spinal symptoms, whether you're having difficulty with speech or computer access. You know, we also think of it as an umbrella because we're being proactive. I have an umbrella in my car because I have a very long walk from my car to the clinic here at Sunnybrook. And it's not that I always use it, but if it's raining, it's really handy to have it there. We also consider social situation, what type of supports you have at home, what are your goals, what are your interests. So AAC is really a combination of a person-centered approach with some expert guidance of the tools available. But it's also driven by self-advocacy. So patients know what they want to achieve. And our job is to kind of educate about what are the realistic options to help you meet those goals, and kind of guide you with what we think would be helpful for you with respect to what you'd like to accomplish. So now we'll get to the actual strategies and tools. We divided different AAC strategies into stages, and I'm putting stages in quotations because it's really for the purpose of organization. It doesn't correlate specifically with stages of the disease of ALS. Really, there's no single strategy that's confined to a given stage. It's really based on individual needs and goals. But just for our purposes, we considered stages to kind of group them. Just something to remember, that it's not that you can only do one thing at certain stages. They're all relevant, and we're just going to focus on one stage at a time to get through our nice list of different strategies. And with that, I'm going to pass it over to Melody.
Thank you, Abner. So for the early stages, you can start by implementing what we call compensatory strategies. So these strategies are ways to optimize the clarity of your speech. So for example, you can start by over-articulating, which is exaggerating your mouth movements for words or sounds that are more difficult to pronounce. You can speak at a slower rate. You can use shorter phrases. You can also practice vocal hygiene, which means to keeping yourself hydrated, avoid straining your voice, and also giving your vocal cords ample amount of rest. There are also environmental strategies to consider. So being face-to-face with the person you're speaking to, avoiding loud environments, and reducing background noises like turning off the TV, turning off the radio as an example. And also in group settings, it'll be important to ask one person to speak at a time. And if it's harder to use those compensatory strategies, you can use a text-to-speech app to help clarify your speech. It's great for individuals who are able to use a touchscreen still on a personal device, such as a phone or a tablet. Typical text-to-speech applications allow you to have a synthetic voice speak out the message that you type or select. To help increase the communication rate, applications also have the ability to store custom phrases. So you can prepare topics or messages for certain situations, like if you're going to a doctor's appointment, if you're ordering your favorite food at the restaurant, or even to direct your care. Robust applications would allow you to store phrases into different categories, which will further increase communication efficiency. So if you look at the screen here, we have a picture of one of the apps we typically recommend, which is Speech Assistant AAC. We recommend this because it allows you to categorize your personal phrases. It also allows you to type novel messages. They also have a lot of customization features available. It's a very low cost application. You can trial the free version on an Android device. It's $10 for the full version, which will allow you to make customizations, and it's $30 on an iPhone or iPad. There are, of course, many applications that are available in the market. They do serve different purposes and have different price points.
So I'm going to jump in for this part and talk a little bit about voice and message banking. And this is just going to be a really brief overview of voice and message banking. Some people might be familiar with it, but really we could probably arrange for like a whole webinar just on this topic because it can be quite confusing, overwhelming, and there's a lot to go through. But just for a brief overview. So Melody was talking about text-to-speech apps like Speech Assistant AAC. When you use an app like that, you'll have access to a synthetic voice, as Melody said. And that's the robot voice that speaks out the message when you select something on your phone. Every phone, computer, tablet, any device nowadays have text-to-speech voices or synthetic voices built into the device. If you would like to personalize that experience, you can do this process called voice banking, which is essentially creating a synthetic text-to-speech version of your voice that can then be used with an app like Speech Assistant, like a text-to-speech app on your phone. One thing just to remember is that this is optional, and many patients do not actually complete voice banking. It does not restrict anyone from accessing communication aids because you have access to so many text-to-speech options. This is really a personalization idea. And we do recommend recording through a trusted online service. There are many options out there, and there's lots of new ones. There's artificial intelligence, voice cloning. There's new options through Apple. There's a relatively new free voice banking option through your Apple device, depending on what version it is, through the accessibility settings. But there are limitations with the newer ones, and these programs have been around for a while. So we do recommend going to a trusted online service. We'd also recommend starting early. And that means when you've had little to no speech changes in order to get the best results, although you can do voice banking at different stages of changes to your speech. The other option we can look at is message banking. And message banking is a bit different because that's when you're recording specific messages and that you would like to have preserved in your voice. And those sound files can then be added to an app so that the actual recording is played when you select that particular message. The difference is that with message banking, if you only do message banking, you're restricted to the recorded messages that you saved. In contrast with voice banking, you have this synthetic version of your voice where you can type out anything and have it speak out that message. Message banking does have an upside though. There's little to no cost because you can just record messages on your phone. And and with a free recording app. And it's not dependent on your speech clarity or sound quality. So you do have a little bit more flexibility with message banking. So just a couple of quick takeaways, and if there are questions, we can get into it a bit more. Voice and message banking are both optional. They're not going to restrict your use of AAC communication aids. We do recommend starting early if you're interested, and really just refer to your specialist for guidance because there's so much involved with this. It's best to connect with a speech pathologist or your ALS clinic for further guidance.
Great, thank you, Avner. So moving along to other early stage tools, if you have difficulty with accessing the touchscreen device or using your computer, mouse, or keyboard, there are various built-in features on your device to make things more accessible. For example, on your phone, you can use swipe to text. So that's where you glide your finger on an on-screen keyboard to type words. It significantly increases your typing speed by reducing keystrokes, and it's great for users with reduced finger dexterity. There's voice command, where you can control the device with your voice. So for example, you can open and close an application without using your hands. There's also voice dictation. That's the speech to text feature. We will discuss more sophisticated voice dictation softwares later on in this presentation. For a computer, if you have decreased hand function and it's more challenging to use an external keyboard or click on a mouse, you can use an on-screen keyboard. We'll demonstrate the use of an on-screen keyboard when we do our device demonstrations at the end. There are many more built-in accessibility features. We recommend you to refer to the accessibility section in your device settings. We'll move on to the middle stage tools. And again, we're using early, middle, and late stages just as a means of categorizing some of these tools. But you can always implement it across different stages, depending on your goals, needs, and abilities. If you have any difficulties with speech, but your handwriting is still intact, or for folks who are less keen with technology or do not own a smartphone or a tablet, you can use a mid-tech option like the Boogie Board, which is pictured on the left here. It's a paperless writing tool where you can use a stylus to write on an LCD screen, and you can easily clear the contents with just a touch of a button. This is a great replacement for the traditional marker, whiteboard, and or pen and paper kind of options. It's a lot lighter and requires minimal effort to erase the content of the screen and start a new message. There are other low-tech options, which is pictured on the right. There are many customizable paper-based displays, which we will discuss again later, but here is an example of a spelling board, which we recommend using with a whiteboard to keep track of the progress. This spelling board can be used in different ways. You can point to spell out full messages, or you can use it in conjunction with your speech, mainly to help clarify your message. So you can point to the first letter of the word as you speak. You can also use this board with a method called partner-assisted scanning. That's a hands-free option of using the board, which again, we will discuss a bit later and show an example. If your speech is clear, but you have difficulty with projecting your voice or you fatigue from talking, you may benefit from a voice amplifier. So that's pictured on the screen here. It's essentially a microphone or headset connected to a portable amplification unit. So it amplifies your natural speech. So just note that this might not be a successful long-term solution. It's only recommended if you have not experienced changes to speech, so you have no to minimal slurring. If you are able to use a touch screen, but you find your phone is going to be too small for typing, or you're interested in a more dedicated device, you can look at something called a speech generating device, or SGD for short. SGDs are a tablet computer that are designed for communication. There's a built-in software with more customization features, They're typically equipped with loudspeakers and they're very durable. For SGDs, we do recommend going through an AAC clinic, as based on your goals and abilities, the clinic can help with the selection and customization of the device. They can also review funding options with you as well. Now, if you have difficulty with accessing the touchscreen devices or using your computer, mouse, or keyboard, and the built-in accessibility features on your personal devices are not meeting your needs, we can explore specialized equipment or softwares. For example, there's Dragon Natural Speaking, which is a sophisticated voice dictation software for Windows. On MacBooks or Apple computer, there is a comparable built-in dictation feature. If you're having difficulty hitting the right key on a keyboard, you can get a key guard. That's a 3D plastic overlay that's placed on top of the keyboard that can help with typing precision. There are various specialized mouse devices to make mouse control a lot easier, such as the trackball or a joystick, and even a head mouse. A head mouse is a specialized camera placed on your computer. The camera tracks a reflective sticker that's placed on either your forehead or a pair of glasses. And then you can control the mouse hands-free with your head movements.
All right. So now we get to, again, in quotations, late stage communication aids. So this is what we call custom low-tech communication aids. Low-tech communication aids in general can include spelling boards like the one we saw before, as well as message boards, which you see on the screen here. And so this is a general display with some basic care messages and pictures, and you also have the yes, no, or something else at the bottom if the message that you want to relay is not on the page. Message displays like this can be customized with lists of messages that are relevant to the individual's daily conversation and their care routines. So we often will create a communication book with lots of pages like this that have preset messages that we know are relevant to you. If pointing is difficult, we can use partner-assisted scanning, and like Melody was talking about before. So we're going to show you what that looks like. Partner-assisted scanning, as Melody said, is a hands-free way of using a low-tech communication display. The first step is that we need to establish a selection method or a yes response. And we don't need a lot to do that. You can verbally say yes if we're able to hear your voice, but you can do something as simple as an eyebrow raise or a blink. And so just to kind of demonstrate it, we have a pair of eyes here. We're going to show you how to use it. Basically, we're going to scan through the option, scan through the rows, because we have it set up on a grid display. Where we can get to the precise message with the conversation partner holding up the board and scanning. So just imagine this highlight is the conversation partner pointing to the first row here. And no, it's not in that row. So the conversation partner is going to point to the second row. Okay, we got a blink. So that means the message is in this row. And now we can start scanning through the blocks. Is it this one? No. Is it this one? Yes. So now we know that the message the individual wanted to say is that they're hot or cold, just by blinking their eyes and using the partner-assisted scanning method. And they open their eyes again. Integrated systems. So we discussed high-tech supports for communication, speech generating devices or SGDs. We also discussed writing aids, like all those computer accessibility tools that Melody talked about. Integrated systems refer to high-tech communication aids that combine speech generating device, like the high-tech communication supports, with an alternative access method. And this kind of goes back to what we talked about with verbal and written communication. This covers all of the impairments you might have in one integrated system. There are various different types of integrated systems. We often recommend eye gaze. So head mouse can, like Melody showed you before, that's where there's a camera on top of the computer, and there's a reflective dot that you put on the individual's forehead or on a pair of glasses, and the camera picks up that dot, and you can move the mouse around with your head to make selections. That's one example of an integrated system. But for persons with ALS, we often recommend eye gaze or eye tracking because it tends to be the eye function or ocular motor function tends to be preserved longer into the disease course, and therefore it might be easier to use eye gaze or more reliable for long term. So for the pictures here, you can see some eye gaze computers. Some of them have a camera actually built in. So the one on the left has a camera at the bottom, and Melody's going to show you actually one of these devices at the end. And then on the far right, we have an eye gaze camera that's kind of sticking out from the bottom. Usually we do recommend some type of mounting system if we are using eye gaze, because it does require the individual to be stationary. So you can see on the right, we have a mount, and that the device is mounted on. And there's different types of mounts. There's floor mounts that can be rolled around, as well as mounts that can be connected to a wheelchair. So we talked about AAC, we talked about all the different types of tools and strategies, or at least some of them. And we kind of alluded to AAC clinics. So what are AAC clinics? We can speak specifically to Ontario because that's where we are, and that's the system we're in. Although this might vary across Canada, because I know there might be some folks here who aren't just in Ontario. But at least in Ontario, AAC clinics are clinics that are designated by the Assistive Devices Program of the Ministry of Health to provide AAC services to eligible clients. And who is eligible? It's basically any individual who has a physical limitation that affects their communication and or writing. So anyone with ALS will be eligible for this service. The criteria, it will depend on your needs and goals at the time, but that can be judged by a clinician at an AAC clinic or whoever might be referring you to a clinic. And there also are different mandates and catchments for different clinics that we'll see, pediatrics or adults or different patient groups. Again, that's something that your clinician will help guide you. In terms of what an actual AAC clinic does, there's a few different roles. And to sum it up, it's to prescribe and dispense communication and writing aids, to provide education, support, and training to patients, families, and caregivers, to authorize funding for communication aids, and I'll explain that in the next slide a bit, or in the next few slides. And lastly, to advocate for clients and to share expertise regarding latest technologies. So part of our role at the AAC clinic is to advocate actually back to the government about what types of new technologies are available and would be helpful for clients. And just as an example, at the Assistive Technology Clinic at Toronto Grace, we were one of the clinics that recommended a new iPad-based eye gaze system that's now accessible through the funding program. There is a fixed structure for AAC clinics in Ontario. So they need to be designated by ADP or the Assistive Devices Program. They usually have specific staffing requirements, including a speech pathologist, an occupational therapist, a communicative disorders assistant, and a technologist. But there's also different services provided by specific clinics within Ontario and between your ALS and AAC clinics. So some interventions might be provided at the ALS clinic level. It depends on the scope and the capacity of the ALS clinic team. For example, here at Sunnybrook, I do a lot of education and recommendations when it comes to text-to-speech apps on clients' personal devices. Whereas at another ALS clinic, they might refer you to an AAC clinic for any type of intervention. So in terms of reasons for a referral to a clinic, there's lots of reasons. It might be more proactive, so to get started on voice banking, provide education, early adoption of devices before you need them, to kind of familiarize and become more proficient with using them before you need them. And mainly what it comes down to is access to those communication aids that are limited to the clinic, at least in Ontario, for funding. So we do have funding for custom low-tech communication aids and dedicated high-tech equipment. Funding for communication aids is consistent across Ontario because we have the Assistive Devices program. And so basically, there's a lot of information about how the funding program works. Don't feel like you need to memorize anything. That's something we would help you out with at the clinic. But just overall, ADP typically pays for 75% of the cost. They also have this place called the Centralized Equipment Pool, which is contracted to ADP, and that's where we get all of the equipment from. And they also have a really great leasing program, which gives you access to equipment, to trial equipment before you commit to a lease, as well as ongoing supports. There's third-party government programs like the Ontario Disability Support Program and Ontario Works. In Ontario, we have a lot of options. If you're in a different province, I'm sure there are some government programs, although I'm not familiar with them particularly. Insurance tends to be more policy specific, so it's not necessarily associated with provincial funding structures, but your insurance might cover some costs for AAC. Agencies may require the client to access the government funding first before they're eligible for insurance. So it does make sense, again, to go through an AAC clinic, see what you're eligible for through the government, and then often we at the clinic will write letters for clients to present to their insurance to request additional funding. You can also get some tax returns. I'm not going to go into that because I don't understand how taxes work. Maybe some of our accountants can speak to that on the call. And lastly, and really most importantly, is ALS Canada is, as you know, an amazing organization, and they do have a funding program even for in Ontario for the portion that the client is responsible to pay for. That is income dependent, and it might be different for different provinces. The best thing to do is to talk to your local AAC clinic or refer to Emily or your local community lead at ALS Canada, or even just reaching out to ALS Canada directly, and they can always help you. And we would advocate for that funding on your behalf at the clinic. So when should I be referred to an AAC clinic? I did promise that we would answer all the questions at the beginning. The main answer is that there is no right or wrong answer. It really does depend on your stage and your needs and your goals. So you might need different things at different times. You might want different things at different times. It really can vary a lot. And there, as you saw, there are lots of different options available, lots of tools available. So it really depends on what's important to you and what you do need. It's also important to remember that you can be referred to an AAC clinic when you feel ready. So it might, like I said at the beginning, some of these things can be overwhelming, and we understand that. But it's also, if you do feel like you want to learn about AAC or get accustomed to a communication aid, it's never too early. And so it's always okay to ask about that. One really big takeaway, if you take anything from this webinar, is ask to be referred to an AAC clinic if you're thinking about purchasing a computer or a tablet. We don't want you going out and paying a whole bunch of money for a device that you could access government funding for. So that's just something to ask. There might be a reason why you would get a device, but just double check with us first so that we can save you some money. And lastly, if you're still not sure, which is okay, refer to your healthcare specialist for guidance. So going to your ALS clinic if you're associated with one, if you have a home care a service provider like a community SLP or OT, speech pathologist, or occupational therapist, and of course your amazing community leads and intake folk at ALS Canada who can always help you. If there's any clinicians on this call that want to know about what makes sense in terms of referring your client to an AAC clinic, as I said before, we're looking at any custom low-tech communication aids, high-tech communication devices, writing aids, and integrated systems. And again, if it's something you're not sure about, reach out to us and we can always help guide you. And without taking up too much more time, we're going to get to the fun part.
All right. I guess we can, do we need to close the presentation? Can everyone see my screen clear?
Maybe I'll stop showing the presentation so that we can still see you.
Perfect. So I'll show you some, I guess, tools and devices that we have in clinic, just starting with the low-tech tools. This was an example of a communication board that you saw earlier on in our presentation. Just some generic phrases on this page with to direct your care. And at the back, there's an alphabet board if you needed to say something that's not on the generic board. Another example of a low-tech communication aid is a communication book. Typically, we also dispense these communication books to our clients who do move forward with a high-tech device, so like a speech generating device or an integrated system. This is like any technologist, like any technology, in the case that it does break down, you can still use this as a tool to communicate. So typically would have phrases from the client's device, but just in paper format. So there's pages for the category, and you can either point to the messages or categories, or you can use partner assisted scanning here, and then there's always an alphabet board at the back. For speech generating devices, I do have a couple. I'm just going to show it to you, and then I can do a quick demonstration of one of them. So what I have here is an SC tablet mini. So this is an Apple-based tablet with just specialized loudspeakers and a very durable case. So this is around 6 inches. And then we have a Tobii i110. This is a 10-inch device. Sorry, this is 8 inches. So like Avner had discussed earlier, there are a lot of devices that are available in the market. We do really recommend speaking to your AAC clinic to just so that you can discuss about your goals and what your needs are, and the AAC specialist can help you determine what best meets your needs. So on these speech generating devices, there are very robust communication applications or softwares. This is just one example. So this is where you can have your saved messages.
Please use the speakerphone so I can hear what you are saying.
So that's just an example of a synthetic voice. But we always recommend having these custom phrases because it will speed up the rate of communication. So things that you say on a daily basis, it's best to save it as a message. But there's always a feature to type new messages. So something's quick.
Hello.
So these devices can go even louder. I think it's a bit softer, but you can turn up the volume as well. So that's sort of a pro, like if you get a speech generating device, it has those nice loudspeakers compared to maybe your traditional phone or tablet. All right, I guess everyone's probably wondering what device is sitting behind me. This is actually an eye gaze device that I've set up. This is the Tobii i16. It's a 16-inch Windows computer. It does have its communication software, but you can use it as a regular computer. So you can surf the web still, you can access social media, you can pair it with your phone as well. I'm going to turn it back on and hopefully everyone can sort of see the screen. So this is the main page of the communication software. I'm just going to show you the communication page sets that we typically use. So this is an example of a keyboard. And I'm just using my eyes to make selection on the screen. And like your phone or tablet, there's also word prediction. Again, word prediction will help reduce the keystrokes and improve your communication rate as well. So I just use word prediction to finish typing out hello, and I'm going to speak out the message.
Hello.
So if you do decide to move forward with voice banking, you can have your own synthetic voice as the voice on these devices. So bringing back to what Avner said, it is important to make sure you are using a trustworthy, I guess, company for voice banking, because there are so many on the market, and not all of them are compatible with the softwares, applications, or devices that you would or potentially be prescribed by the AAC clinic. So that's sort of the keyboard, and then again, there's the option for custom phrases as well. Sorry, I'm being mindful of time because I'm sure everyone has a lot of questions for us, but that was just a quick demonstration of the eye gaze device. There are a lot of, like I said, other features available. I don't know if you can see, but there are smaller icons here. There's Facebook, you can access YouTube. These are what we call accessible apps. So Toby has made these specialized apps that are all eye gaze accessible. So all the navigational buttons are nice and big and easier to target. I don't know if we'll have time to see this page load, but I'll keep it running. And so you can see how these dedicated applications look like. So the method I'm using to activate the buttons on the screen is what we call dwell. So dwell, you're just sort of looking at the screen, and after enough time passes, a selection is made. So you don't have to use your hands at all. So there are a lot of ways to make selection faster, like you can decrease the dwell time. Like I mentioned, for keyboard, you can use word prediction to help, or use saved messages to help speed up, at least to communicate your needs. So if you can see, all the navigational tools are on the left, and so I can still watch my favorite YouTube videos. So we can do a quick search. I'm going to type cats. And that's my search. Avner mentioned that typically we recommend mounting these devices. We have it on a floor mount because the floor mounts are the most versatile options, because you can use it when you're in bed, when you're in the sofa, when you're in your wheelchair as well. There are a lot of different mounts out there too, like wall mounts and table mounts, but you would be more restricted to which environment you can use it in. So again, back to the just referring back to your AAC clinic, speak to a specialist so they can better help you choose what mount would meet your needs and such. But I think that's it for me.
Yeah, so I think we can pass it over to Emily now for any questions.
Yes, thank you guys so much. We do have a few questions that have come in, so I will just start asking them and kind of go through. If any questions come up while we're talking a little bit more, please definitely put them in the chat and we will get to those questions. So it's a few different topics, but when someone is interested in getting connected with an AAC clinic, is it necessary to have a referral from a doctor, a healthcare professional, or can they also be self-referred?
That's a really good question. I can speak to how the clinics in Ontario do it. I don't know about other provinces, but at least in Ontario, it actually is variable. It depends on which clinic. Some require a doctor's signature. Some require different things to be on the referral. At the Assistive Technology Clinic, we do accept self-referrals. Although we do recommend having a healthcare professional either send the referral or be identified in the referral so that we can get in touch with them. So it really depends on the clinic, but if you are already connected with a healthcare professional, that would be my recommendation, is to ask them to help you send the referral on your behalf so that they can help with part of the navigating. And it might be needed depending on the clinic you're referring to.
Perfect, thank you. Are there any specific programs that you would recommend to someone who is interested in voice banking? I know you guys mentioned that sometimes with voice banking, it all depends on the devices that someone's using. Is there anything that you guys would recommend? Yeah,
that's a great question. There's actually a bunch of different options that I typically recommend. The one that is probably most commonly used, has been around for probably the longest, is a company called Model Talker. And if you type them into Google, you'll find them. I think it's modeltalker.org. And so that's a grassroots company based out of a university in the States. They have a really good program. It's not too costly, and it does require a lot of recordings, but it is doable if you get started early and if you have access to a computer and some basic equipment to do your voice banking. There's a couple different options out there. I'll just list a few. The Voice Keeper is an online company. Acapella or Acapella My Own Voice is another company. That one's a bit more costly, but really quick and easy to use. There's a couple of European companies as well. One is called Speak Unique, and there's another one called Cereproc. But from what we've experienced, a lot of clients go with one of those first three: Model Talker, Acapella, or the Voice Keeper.
Thank you. How long does it take after your first visit to the AAC clinic to get the equipment?
That's an awesome question. We do get that one a lot. Again, it's going to be different depending on what clinic you go to, but I can speak to what we do at the Assistive Technology Clinic. And basically, it depends on how the first assessment goes. If we get all the information we need, then we can make a recommendation after our team kind of discusses and decides on what we think would work best for you to meet your needs and goals. And then we ask for a couple of outstanding items before we start ordering equipment. So that's the part that's variable, because it depends on how quickly you get those items in. It's not a whole lot, but it's just, you know, you have to sign the form for the government funding, send us some messages, and so on. And so once we get our outstanding items, usually it's about 4 to 6 weeks for us to order the equipment from the equipment pool, set it up. Melody programs the device, and then we schedule an appointment to just do the dispense and training. That can be a bit variable, and sometimes it can be faster, sometimes it could be a bit longer, but that's the typical timeline. So I would say, just to kind of give a general overview, if you're thinking about AAC and you want to get started, give yourself like 2 to 3 months from the initial referral to getting a device, at least with our clinic. Other clinics, it might be longer depending on their wait lists.
Thank you. So we do have a few individuals that are connected with Sunnybrook. How far are AAC services delivered in clinic? For what things would we have to be referred out to a specialized AAC clinic?
So that's a good question. It's hard to answer specifically because it really depends on the individual and what they're dealing with at the time. When it comes to like a dedicated high-tech communication device or computer access device, that's when we'll typically recommend a referral to an AAC clinic, or if we're looking at something more customized, like a custom low-tech communication book. But there are so many different variables depending on what you need. So for example, just going back to what we talked about at the beginning, there's text-to-speech apps on your phone. And you might be the type of person who always has your phone with you. You're doing really well with typing on your phone. Even if you have a bit of hand weakness, it's still functional for you. And you might even prefer to use that app as long as possible, and maybe even consider getting a portable Bluetooth speaker if the volume's not loud enough. And if for that type of person, I would agree with you. Like, let's continue to use your phone. We don't need to look at any high-tech devices. But the same type of person with different goals might want to get a device sooner so that they have it set up for them and they can get some support if they're not particularly techy, or they could benefit from Melody's amazing customizations. So it really kind of depends on your situation.
Thank you. What communication aid would work best for a late-stage patient in times when they are very tired or at risk of falling, and it takes a long time to grasp what they want with very limited speech capacity?
That's a really interesting question. So my initial reaction to that is I would need a bit more information. Even though you've given me a nice kind of picture, what I'm missing here is a couple of things, but mainly what's your hand function like? Because if you do have good hand function and you're techie and you're able to access a device like pretty easily, then we would probably recommend either using an app on your phone or a high-tech device, depending also on your cognition and your awareness and your tech experience. And like I said, there's so many different factors. So the falls risk, I'm not sure if it necessarily has a whole lot to do with it. It's definitely part of it will go into our decision making, but we really need to know everything about you. And like I said before, when we're talking about late stage, the stages for us don't coincide directly with what type of device we recommend. It's really based on your needs. So for that person, I don't have a definitive answer. I would say go to your clinic specialist, get referred to a clinic. The clinic will do a comprehensive assessment and look at everything about your life to really get a sense of what is it that will help you and meet your goals of what you'd like to accomplish. I hope that answered that.
Thank you. I appreciate you answering that. There's a few more questions here. Is it realistic to speak by remapping phonemes that are too hard to say?
So I'm not sure exactly what you mean by remapping phonemes. If the attendee can clarify that in the chat, we can come back to it. But I guess if what you mean by that is using different words or different, yeah, like thinking of synonyms for the words that are hard to say because of the particular sounds that are difficult to pronounce, that's a good strategy for sure. It might restrict you in the options you have to communicate, but definitely if that strategy works for you and you're pretty quick-witted that you're able to kind of think of a synonym with a different sound structure, all the power to you. I think that's a good strategy.
Can I also jump in for this one?
Please. Yeah.
I guess if you're finding certain phonemes are hard to articulate, you can also maybe use your speech in combination with a low-tech board. Like that's one way to use a low-tech board to help support communication.
Mm-hmm. And just to add to that, Melody, I think talked about one of the compensatory strategies, which is over-articulation, and that's kind of exaggerating your mouth movements. Even if there's a particular phoneme in a word that's hard, and phoneme for everyone, that's an individual sound in language for anyone who not familiar. If there's a particular sound that's hard for you to pronounce, using that strategy might still help make the sound clear enough for the listener, and also help them see your lip movements. So for example, if I'm saying the word communicate, I would go communicate, really stretching out those mouth movements. Even if the phonemes aren't, or the sounds aren't clear, it might, with that context, it might be clear for the listener.
Thank you. Just 2 more questions. There is a lot of praises being said about you both, so it's really great, and a lot of people appreciate not only this presentation, but working with you both previously, which is really great. So I have an individual here that says, I feel I'm in the in-between stage with my voice. I notice in talking one-on-one with people, my voice will go lower, softer, where then I am repeating myself and making the extra effort to push my voice outwards. It is still faster for me to repeat myself as opposed to use a device to keep the conversation going, even though I am getting more tired with my voice as the day goes on. I'm not sure in what way to go for an assisted device. Is there a device or recommendation that you would make for what might be needed at this time, but maybe not all of the time?
That's a really good question, and that's something that should be stated as well, which is that there isn't a clear answer for every situation. And I said that you should always reach out to look at devices, but it's also about kind of finding the right time, and finding the right time isn't always easy because there's always going to be some in between where it's not clear that you actually need something or that it would necessarily be helpful. Like we were saying, AACs often or always slower than natural speech. But I think there's always some tool that would be helpful just to have as a backup. So for this individual, there's a couple different options, again, depending on some more information about your hand function and other factors. But you might benefit from using a voice amplifier just to help you to avoid straining too much when you're talking, and take a little bit of the effort out of talking so you don't get too fatigued. You might benefit from a speech generating device or even a text-to-speech app on your phone. A lot of the times when I'm talking to patients here at the ALS clinic at Sunnybrook, I talk about a bunch of different options because it's not always clear that whether one thing is helpful for you or even whether a clinic referral is helpful for you. It really does depend on what's important to you and what you're interested in. So I would say refer to your specialist if you are followed by a speech pathologist, if you're not asked if you can meet with one, because they can help guide you and talk about the different options that are available to you if you're still not sure about it.
And so my last question that's come up is, can someone make their own picture communication board, or does it have to be done through a clinic?
Yeah, definitely you can make your own. We're very happy for you to. Melody has a lot of expertise and experience with making boards, and she knows how to make them more accessible to clients. But for really simple displays, I will often recommend that doing it on your own. A really simple version of a board, like if you're really in a crisis where it's hard to communicate and you need something really simple, is what I call a numbered message list. That's, you take a piece of paper, you write 1, 2, 3, 4, 5, and then I need to use the washroom. Please reposition me. I need a tissue. Some really simple things like that. And you can do partner assisted scanning or pointing just to get to the right message. If you want to make something a bit more sophisticated and you happen to be a bit artsy, that's great. But there are really great customizations that we can do through a clinic that will really optimize how you're using it from a communication perspective. I don't know if there's anything you want to add to that, Melody.
No, that's great. But if you would want to maybe be more proactive and create your own message board and such, like Abner said, I just made this using Microsoft Word. So just keeping in mind not to put too many things, too many options on a page is important. I always include pictures because if someone maybe perhaps speaks a different language and their caregiver speaks English, like you can provide a symbol or picture, so it's still easy for the individual to find what they need and for the communication partner to understand. Yeah, and there are also some low-tech communication boards that are already pre-made, and they like the hospital ones. I think there are some that are available online that you could download and use just in the interim before you're able to meet like an AAC specialist, where we can customize and again, like our goal is to make it so it's more efficient for you to use.
Awesome. Thank you guys so much for sharing and for answering all those questions. It's been a very good discussion and we really appreciate it. And so on behalf of ALS Canada, we would like to thank you both for taking the time out of your day to join us and just really having a very well-rounded conversation. And I think it's got a lot of people thinking about what options do they have and what is out there for them to access. And the feedback has been very great in the chat and in the questions. And I'm sure we will continue to hear more feedback as we continue. And so for everybody, I do want to let everyone know that this has been recorded. And so the recording will get posted to ALS Canada's website under our resources page, as well as onto our YouTube page. And so it will be available for individuals to watch back and for community leads to send out so that people have access to this for the future. If there are any additional questions, please do not hesitate to reach out to your community lead or to the community services email. The email is communityservices@als.ca, and we would be happy to share any additional resources and answer any specific questions that might come up. So again, I want to thank Abner and Melody. Thank you both for taking this time to have these conversations with our community. And everyone, please enjoy the rest of your day, and we will see you in the months to come. Thanks, everyone.
Thanks so much, and thank you, Emily and ALS Canada, for hosting us.